Today we're going to look at Chapter 4, the urinary system. We'll start with our anatomy lesson. Remember, FTR is facts to remember. The kidney are the two organs in the body. You see them, we're only going to diagram the one side. There are right and left kidneys. The inside of the kidney, you have the different parts labeled. Coming from the kidney to the bladder is the ureter. The bladder is there, and then what is not labeled is the urethra, which is the part of the body between the bladder and the outside of the body. The urine would go from the kidney down through the ureter into the bladder and be stored until it is eliminated through the urethra. So I want us to look at the code book. There are other ways to use the code book other than the index. And this is a good system to look at that technique because it's not as large as some of the other systems. I think it's fairly easy to navigate. And we're also going to watch the colors. So you should be able to see the red. The words in red are the parts of the urinary system. There's the kidney, the ureter, the bladder, and on the next page, the urethra. And under each one of these body parts, there are procedures: incision, excision, repair, manipulation, and other. You also might have a part of your procedures called introduction, which is pretty much of a catch-all, it seems, when it's used, like the bladder has it. Incision, removal, excision, introduction. Again, introduction can be a lot of different things, so don't think of it as just introducing something, but a catch-all really for a lot of things. The urodynamics, the repair, any laparoscopy, endoscopy, which would be a cystoscopy, a ureteroscopy, a cystourethoscopy, transurethral surgery, and the vesical neck and prostate. Remember how in the digestive system, getting to the ovaries into the abdominal cavity was part of the digestive system and not the female system. Similarly, the prostate is included in this section because of its proximity, I believe, to the urethra. Part of this podcast, I'm going to talk about how I used the code book to find something when I was unable to find it in the index. So I'll come back to that a little bit later. Also, you're going to see where I continued to mark up my code book. I use, here's the red, the part of the body, the kidney, and then I'll take the blue, the different procedures, and I'll write beside it what it is: incision, kidney. I do that because on some pages there's more than one. On this page, excision, kidney, renal transplantation, kidney, introduction, up here. Remember, it's those things, it's a catch-all really, for many procedures, and this particular one is removing and replacing a stent percutaneously, just removing the stent percutaneously, and then the same thing, only transurethral. Then we come into a different section, and I talk about that. I make a little note: no fluoroscopic guidance. See Evaluation and Management Code. So if you're not using fluoroscopic guidance, you're going to use a different set of codes. Anyway, back to my notations. I'm still in the kidney. You see how I have everything marked. Here's my other procedure where I get into some of those things under kidney. And then at the bottom of the page, I get into ureter. Now we're in a different part of the body system, and we're going to do ureter, incision, biopsy. And I begin to do my markups for the guidelines. Okay, so you see what I'm doing here. I've circled my families like I have all along. Then we get into the bladder. Now we're doing incision in the bladder, removal of the bladder, removal within the bladder, I should say. There's a lot of these things. Over here we get into the urodynamics. So I'll be looking at these, talking about them more than looking at them because it simply saves so much more time. We can go so much more quickly. There is one, I believe it's your operative report we'll be talking about, that will refer to this group of codes here. And you see how they are differentiated by the size of the tumor. Urethra, similarly, incision, excision, repair, manipulation, and other procedures. So I take the time to show you that just to remind you there's more than one way to find a code. Sometimes it's easier to me to use the code book than it is to use the index. So we'll talk about that a bit more. The trickiest part of the body system, the urinary system, is the terms. I hope that you print out the slides. I offer the PowerPoint as a PDF so that you can just print it out and read it, study it, memorize the terms for the procedures, because depending on the term, it really helps you know what part of the body system you're going to go to and which procedure within that part of the body system you're going to go to. So here I have defined the differences between a cystotomy, a cystostomy, and a cystoscopy. I won't take the time to read those, but I hope you do. And here's the difference between a cystoscopy and a ureteroscopy, a nephrostomy. Again, my images are taken from Google Images unless I tell you otherwise. Fulguration is a procedure to destroy and remove tissue. We have one of our exercises talks about fulguration. The various ways that stones are treated. Calculi is a stone. You can have kidney stones, and I've heard of bladder stones, not as common. And you can have bile duct stones. Remember, we saw those in our last chapter. So one of the ways we treat calculi is through the use of shockwave lithotripsy, also called ESWL. I have information here along with the laser lithotripsy. And while I'm thinking of it, the information on these slides is fair game for an exam. So I expect you to not only know how to find a code, but understand the terms for these procedures that you are looking for. Here's another treatment for stone, a percutaneous nephrolithotomy, abbreviated as a PCNL, and I tell you there what that does, how it works. And here's the difference between a nephrolithotomy and a nephrolithotripsy. A ureteroscopy, you will often hear that word, is a procedure that the doctor using the scope goes into the urinary tract to get the stone. And here are some of these stone extractors that are used, little baskets that are used, that are employed through the scope into the bladder. They nab the stone and then it collapses around the stone and you pull it back out. Obviously, the size of the stone determines in large extent what you're going to use. And here are the stents. We hear often in this chapter about ureteral stents. I have a picture here showing you the stent starting up in the kidney and then coming down the ureter into the bladder. And that stent is keeping the ureter open in order for the urine to flow from the kidney to the bladder. A bladder diverticulum is an outpouching in the bladder wall, you also have intestinal diverticulum, a little pouch in the wall and people can be born with these or they can acquire them. And as I've told you here on the slide, in a gentleman it's usually due to an enlarged prostate, but it can also come from a urethral stricture where there's scar tissue in the urethra from some type of injury or a disease that affects people. A ureterocutaneous fistula, I remind you here what a fistula is, and then a ureterocutaneous fistula is the fistula between this abnormal passage between the ureter and the skin. Uretero, obviously looking at the ureter, and cutaneous referring to the skin. Really, your medical terminology comes back into play when you're looking at the way these words are built, these different terms are built. So if you still have your MedTerm textbook, and I hope you do, take a few moments to really look again at some of those prefixes and suffixes to help you understand the meaning of a word, even if you have never seen the word before, if you can break it into its parts and know what each part means, you can often figure it out. Then I have a urethral coracle, which is also called a urethral prolapse or a urethral polyp. This often happens in women and postmenopausal women quite often. And it will actually fall out of the urethra and sometimes blocks the passage of urine. And it can often be treated just with medications, but sometimes it is surgically treated. And that's when we would be using a CPT code. I won't spend a lot of time talking about urodynamics, except to tell you that a lot of the procedures are the measurement of the flow of urine, the different pressures, figuring out where's the problem. And once you know where the problem is, then you can decide what the treatment is going to be. I do mention the modifier 51 for physician use. If you are doing several urodynamic procedures that are separate from one another or in combination, depending on the way the code description is written, you may be able to code them separately and append a modifier 51 for your physician use so your physician can be paid for multiple procedures being done on a given day. And if your physician is providing only the professional component, which is the supervision and interpretation of your urodynamics, you're going to use a modifier 26 for physician services. And here I have the two urodynamics that are commonly performed. The cystometrogram I'm much more familiar with than the other one, the uroflowmetry. Okay, let's look at our procedures for this chapter. They're not very many. I have the blank slide first so that you can attempt to find it, and then the next slide I will give you the codes. A cystoscopy, left ureteroscopy with laser lithotripsy. So remember what we just read. The cystoscope is going into the bladder. The uretoscope is going from the bladder down into the ureters. So there's two instruments there, but you're only going to code the one that's most distant, which would be the ureter. Your laser lithotripsy is a method of breaking up those stones. It just falls under lithotripsy, 52353. Here's another one, cystoscopy with insertion of a permanent urethral stent. And there's your code. Now I wanted to bring to your attention in the code book, you read it carefully because there are places where the descriptor is for a temporary stent and this one is a permanent. So you want to make sure that your code you're choosing has the correct description. And here's a cystoscopy with bladder biopsies and fulguration, the operative report number 2, exercise 4.30. And you notice when you read that operative report, a 0.5 centimeter lesion was fulgurated. When I went into the index under cysto-urethroscopy with fulguration lesion, I go there and those codes did not differentiate by the size of the lesion. I went back to the index, looked again, and I chose the term tumor. And when I go there, they are differentiated by the size of the lesion. So be sure when you go from your index to your code book and to read your code descriptors, don't ever code from the index because of this very reason. It can send you down the wrong path. Take the code that's been given to you from the index, go to the code book, look it up, read it. Does it fully describe the situation you're trying to code? If it doesn't, then go either back to the index or go to the code book itself, looking under the various body parts and the procedures within those body parts to try and find it a different way. Exercise 431, number 2. Under ultrasound guidance, the physician percutaneously inserts a ureteral stent. This was a new access and no nephrostomy catheter was needed. Now I know that there are codes within the code book that talk about a new access or using an existing access, but I couldn't remember for the life of me where they were. So I tell you here, I kind of walk you through what I did. Initially, I couldn't find a code in the index that referenced at all this access, be it new access or pre-existing. So I went to the CPT codes for the procedures under the ureter and then looked under the introduction, because remember the introduction section is kind of a catch-all of many procedures, and I found in that section the percutaneous insertion of the ureteral stent. When I took that code and found it, I went back, once I had my code, I went back to the index and thought, well, how could I have looked this up with using the index? I could get as far as the ureter, the stent, and the placement, but the code range that is there, the descriptor in the index is with nephrostogram or ureterogram. Both of those I think of as an X-ray procedure and not an ultrasound procedure. So that's why I didn't go to either one of those. So I think in the field I would have just gone right to this section of the code book and found it. So let me show you what I'm talking about so you can follow me in the code book when I say that. I went to the ureter. Now we're in the urethra. Before that was the bladder. Before the bladder, keep going back until I get to the ureter. So I'm in the ureter, and then I was looking for introduction. Here we go. So if you wanted to just start at the very beginning, you would go to where the word ureter is written, which is on the previous page, right here at the bottom. The red is when it's beginning. The section related to the ureters is beginning. And then I have my notes there. So then I went to the part called the introduction because I know it has a lot of things in it. And sure enough, when I started reading, it talks about a percutaneous insertion of a ureteral stent. And when I go over and I looked at my family of codes that I had circled, this is where I remembered seeing it. Oh, it's a little easier to see. So here's the family of codes I had circled. Pre-existing, new access without separate nephrostomy catheter, and new access with separate nephrostomy catheter. And if you remember on our slide, it said no nephrostomy catheter was needed. So that tells us that we are going to be without separate nephrostomy catheter. So you might say, how did you know that was there? Well, again, if you're looking at the body part, the ureter is in red, and in the blue you have the different procedures on the ureter. The first one is incision and biopsy, excision, introduction, which as I said is like a catch-all. There's so many things in introduction. Then here's repair. We're still in the ureter. There's your laparoscopy, your endoscopy, and that's it. That's it for the procedures on the ureter. So it has to be somewhere within those, I don't know, 5, 6 pages. Just another way to use your code book. Closure of ureterocutaneous fistula. And it is in the index under fistula, but I also was able to find it under repair in the ureter section. So let me take you back there. We're still back in ureter, where we just were looking, only now we're under repair. Here's repair. So I would read the guidelines, and look here, just read. In repair, read. Okay, we're under repair codes. And we keep reading, and here it is. Closure of ureterocutaneous fistula. A cystoscopy with ureteroscopy for removal of ureteral stone. And there's your index path and your code. fulguration of a urethral coracle, now when I had a little bit of trouble with this one, so I just want to talk about it. When I look at the urethra procedures in the code book, there is no fulguration procedure. The closest thing is an excision. Fulguration is the destruction of tissue by that high current. So if you're looking for destruction and fulguration's not there, the closest thing is probably going to be excision. So sure enough, when you look there, there is an entry for excision of a coracle. It's also found under the urethra as destruction of a lesion. So I have those two paths there. Cystotomy with excision of a bladder diverticulum. I defined that a little earlier than in this lecture. There's your pathway and the code. Okay. If you have any questions about CPT codes within the urinary system, you can post them in the discussion board along with the index path you use to try to find the code. I will attempt to answer them. Thank you so much and have a good evening.